MGM, a JCI and NABH accredited hospital. We comply with patient safety standards. However, we do differentiate ourselves in our commitment towards quality improvement and patient safety throughout the patient's journey in the hospital. On World Patient Safety Day, I would like to say that each mother and each child at this hospital gets the best excellent routine or emergency evidence-based care and management by our best clinical practices. In each patient care journey, be it safety protocols, infection control protocols, or the safe and effective use of medications, we ensure that we take care of our patients very well. The best clinical outcomes at MGM when it concerns patient safety and patient care comes from not only complying with the standards, but also the compassion, warmth and care that we provide at MGM.
It is extremely important that we ensure good, safe practice during pregnancy and childbirth for every mother who embarks on a pregnancy. We should ensure a minimum of at least 3 visits during every pregnancy to a healthcare facility, at least 1 visit during each trimester of pregnancy. Ultrasound and laboratory facilities may not be available at every healthcare facility in rural areas. So a good way of ensuring that there is a central monitoring would be to have a flagging system where, for example, if the hemoglobin is consistently below 10, or when the healthcare provider finds that the growth of the baby is not adequate during pregnancy, this message can be conveyed to a central unit in a district level hospital where some kind of a flagging system, a red flag, which can be identified and action taken. Anemia is so common that a simple prescription of iron tablets during pregnancy can prevent many of the problems during pregnancy, childbirth and lactation. Ensuring that all the immunization schedule is followed in pregnancy is very important. Tetanus injections have been given for a very long time. More recently, during the COVID-19, immunization of women against COVID-19 is very important and should be mandatory.
Globally, around 800 odd women die every day due to pregnancy and delivery-related causes, most of which are preventable. We all know that bleeding that happens after delivery, which is called as the postpartum hemorrhage, is the leading cause of maternal morbidity and mortality. This, to a large extent, can be prevented by conducting delivery in a place with basic facilities to conduct operative deliveries, basic facilities for blood transfusion, and above all, a trained midwife or a birth attendant, if not an obstetrician, should be available at the place where the delivery is conducted.
Patient safety is our priority. Antenatal care has been formed in order to improve the maternal and fetal morbidity and mortality. What was 1,500 in the last century has been drastically brought down to 160 and 120s in certain countries, and we strive constantly to bring it down to 70 per 100,000 live births, which is the aim that WHO has. WHO has called upon all the stakeholders, which means the governmental bodies, professional organizations, civil society, as well as individual doctors and healthcare workers to do as much as possible to improve our patients' safety. Ain't I proud to say that during the pandemic too, there was no pause in our services, maternal services to our maternity patients. MGM reached to the unreachable. We never stopped any kind of procedures or necessary services for our pregnant mothers as well as their little ones.
More than 600 mothers and 6,000 babies die every day because of childbirth, and out of the 2 million stillbirths, more than 40% of the deaths happen during childbirth. We at MGM ensure that we have adequate and appropriate level of accessibility to healthcare, both for the mother and the baby, and we ensure that there is a team of qualified obstetricians, qualified anaesthetists, backup intensive care in case things don't go as well as it should, And for the pediatrics and neonatology, there is one pediatrician fully trained and a trained nurse at all times for the baby at the time of delivery. We are especially focusing on the golden hour and the golden first minute. If there are twins, you'll find that there are 2 pediatricians and 2 nurses at all times. In my 30 years of experience, MGM is probably one of the safest places to deliver a mother at this time.
We truly believe that patient primacy, as owned by the entire organization, leads to overall patient safety and quality care. In our current healthcare landscape, besides doing good for our patients, it has become more pertinent to do no harm. At MGM, we are a quaternary care hospital. We are a higher referral center. We receive requests for very complex procedures from very, very unwell patients. So how do we balance and mitigate the risks that come with these higher procedures to our complex patient groups? We use our accreditation processes to derive standard operating policies and procedures to ensure that our care is standardized. We rigorously audit our processes to ensure that we are doing what we are meant to do and less harm comes in the way of patients. And most importantly, we listen to our patients. We take qualitative, we take quantitative feedback from our patients to understand pain points and grievances so that we can truly cater to their needs and do more better.